Hello, good afternoon, everybody. My name's Ian Watkinson and I'm a National Executive Member from the North West and also Chair of our National Health and Safety Organising Forum. And it's my pleasure to welcome everyone to this afternoon's first session. COVID-19 is not an excuse to abandon preventative measures for workers or students. And with that, I'd like to introduce you to our speaker, Tim Tregenza, who is joining us live from Bilbao in Spain, where he's a senior manager at the European Agency for Health and Safety. Tim's got vast experience working with different European partners in the education sector on prevention and is also a former inspector for the Health and Safety Executive over here. Tim, you're very welcome. Over to you.
Thank you very much. I will just share my screen because I do have a PowerPoint. Okay, so thank you very much for inviting me to this webinar. It's a pity I can't come across to the UK to do it. Greetings from the north of Spain, where it is bright and sunny. Now, I am working here at the European Agency for Safety and Health at Work, which is referred to normally as EUOSHA. And we are the European Union's information agency on occupational safety and health. What that means is we collect, analyze, and disseminate information, and that's it. We don't make the law. There's the European Commission, DG Employment is the main people who do that in the field of health and safety at work. And we don't inspect workplaces or enforce the law. That is a task for the national level, according to national customs and practice. Just a bit of background, we're a very small agency here. We have about 60 of us working here for reaching all workers and workplaces throughout Europe. And we provide information for the people who make policy and law, people who are researching in occupational safety and health, and everybody who is in the workplace, whether that's a worker, a first line supervisors, managing, people who are managing, directors, health and safety inspectors, safety and health professionals, whoever. We are there providing a lot of information to these people. And also we're very keen to be engaging with other actors, including teachers, architects, and health professionals. Because one of the things we find is that if you take teachers, for example, we're concerned about your safety and health, but if we can get themes relating to occupational safety and health into school curricula, then we have the next generation of workers are prepared better for when they enter the workforce, so they are less at risk from day one. So the big challenge in the education sector is that it's not just about your health and safety. It's not just about the health and safety workers. We have to ensure that workers' health and safety, but equally we've got to make sure that students remain safe and healthy, and we've got to ensure that we have to deliver good quality education. And here I would make a very clear statement about the impact of COVID. It's not a question of COVID measures or workers' health and safety, or student health and safety, or quality of education. We've got to do COVID protection and maintain worker protection and maintain students' health and safety and maintain a quality of education. And that is a real challenge. Now, we talk a lot about managing health and safety. And I would split it in these times into three big things. First of all, prevention. This is quite a European English word we use all the time, prevention. And what we mean is stopping the harm happening. And in this context, yes, we've got to stop people getting COVID. But equally, we've still got to stop people getting hurt or ill in other ways. Secondly, we have to do mitigation work. So if somebody gets COVID, we've got to ensure the well-being of that person who is affected. And also we've got to maintain the well-being of the people who are still working. And finally, well, if somebody's gone off, they've been sick or whatever, we have to get that person back into the workplace and ensure that that workplace is adapted to the worker. And at the bottom in big red lines, I say this very, very clearly. If you're not doing the prevention part of that, the rest won't follow. You've got to be trying to stop the harm in the first place. And when I say harm here, I'm talking damage to somebody's physical or mental health. Psychosocial risks, work-related stress, violence from third parties, harassment, bullying, these are also health and safety issues. Now, we have to approach this from a legal base, and from the European Union, we have a series of about 30 directives. I think there might be 35 now. And they all come back to the same model. And they all come back to a directive which is usually referred to as the Framework Directive, which is 89391 EEC. And that tells you what you have to do. It's a very, very short document, very, very short directive, and it gives two things. First of all, it gives what we term a hierarchy of prevention. That tells you what you have to do and in what order. And it tells the employer, it also tells workers, what their legal obligations are. And these directives have been transposed into the national legislation of every member state. So when we talk about the hierarchy of prevention, the first thing the employer should be doing is avoid the risk. Avoid it in the first step. If you can get rid of a risk, do it. If you can't avoid it, then you have to evaluate the risks, combat them at source. If you can't do that, you're looking to substitute the dangerous for the less dangerous. That's not possible. You're looking at collective measures, and as a last resort, personal measures. So it's a very, very clear hierarchy. And one example I would give about that, if you think into let's say a factory, a noisy factory, if the employer in that factory just gives his workers hearing protection, but has not tried to reduce the noise, has not tried to substitute noisy equipment for less noisy, has not tried to put collective noise control measures in place, technically they are not complying with the directive because they have to go through all those first steps before they get to the personal measures. The employer has to have a coherent safety and health policy. They have to give information and training in occupational safety and health to the workers. There's an obligation to adapt the work to the worker and not the other way around. And this is tremendously important, especially in the area of ergonomics. You have to adapt to technical progress. You can't just go, well, we've always done it like this. And there has to be a consultation with the workers. Now, on that slide, I mentioned the evaluation of risks. And this is where I use the dread term risk assessment. And I know that many of you will be very familiar with this term, and you are probably always absolutely delighted when you're asked to do a risk assessment if you're taking a school trip out or whatever. But the risk assessment, quite simply, is the process which we use to identify the hazards and the risks that have a potential to cause harm, analyze and evaluate the risk, the probability associated with that hazard and what it could do, and then say, how do we deal with this? How can we eliminate it or otherwise control that hazard? It's actually, we're very careless when we talk about risk assessment, because in reality, what we're talking about is a hazard and risk management process. One thing I would highlight about risk assessments, they are dynamic. You can't just write them, file them, forget them, put them on the shelf, let them gather dust. It is a living, dynamic document. Every time your workplace changes, potentially your risk assessment has to be updated. Second thing, you can't do a good risk assessment without talking to the workers. Now, we do a survey in the agency. We survey 36 countries and I think in total over 50,000 workplaces. And we send a lot of questions out. And what we try and do is find out, what do people really do? And one of the questions we actually asked was, do you protect workers from psychosocial risks, from work-related stress, violence, and bullying? And the picture's pretty mixed across Europe, and a lot depends what sort of work you do. And in fact, the education sector across Europe is pretty good at managing psychosocial risks. However, of those people who said, yes, we're the good guys, we manage these risks like stress, only about a third of them actually said we talk to the workers. Now, how do you identify problems and put in place workable solutions without talking to the people who are being affected? You can't. So really important that there has to be engagement between the management and the workers to sort out what needs to be done. And finally, the risk assessment is useless and pointless unless you actually do something with it. Too often you'll talk to people and go, yeah, we've done our risk assessment, here it is. And I used to get this as an inspector many years ago. I said, look at my risk assessment, isn't it good? I said, yes. And what have you done about it? You've told me here you've got a problem. Have you changed anything on the workplace? And I go, no. So you've got to do your risk assessment, and then you've got to act on it to change the situation in the workplace to protect the workers. So coming into times of COVID, the first point I'd really say is this. In the workplace, COVID is a health and safety issue. Yes, it's a public health issue, but when you're at work, COVID is a health and safety issue. It's covered by the Biological Agents Directive, how that's implemented in the member states, and the Framework Directive, how that's in the member states. And you have to say, yeah, okay, how do we protect workers from COVID? But then you've got to say, what new hazards and risks are being created by this pandemic? Because by putting in measures for COVID, you may create new dangers, increase a risk somewhere. And so you may have to also change your preventive measures you put in place for those other workplace risk factors and hazards. And in doing this, we mustn't forget the welfare issues, toilets, access to drinking water, and things like this. And one very important point is that you can't ignore people who are sharing properties, who are maybe not employed by the school, but your catering staff, your cleaning staff, your delivery drivers. Okay, they're employed by somebody else. But the COVID doesn't know that. The COVID doesn't care about that. So you have to be working together, all the employers, to do this. Okay, so just some of the issues that has arisen. And first one here, lack of movement leading to increased risk of musculoskeletal disorders. Sorry, this is more jargon. MSDs is musculoskeletal disorders. And what I mean there is we're seeing that in classrooms, you're put in your spot and you're told not to move. The students are, and also the teachers are. You're expecting people to sit still for an awful long time. And that's not just bad for a learning environment or a teaching environment, it's also bad for your health. A second issue, voice strain. This is a big issue already with teaching. But if you're trying to talk through a mask, if you're trying to project your voice over a classroom that may be a bit bigger than normal, it might be a classroom where all the windows are open. Here in Spain, all schools basically have all windows open because the increased ventilation reduces the risk of transmission. So imagine you're trying to teach in a classroom through a mask, and your pupils, your students are further away than normal. What's this going to be doing to your voice? We're seeing a lot of ad hoc classrooms as people are trying to space out the children, space out the students. Okay, there was one case recently reported in Italy where they said, oh, look at us, we're using the chapel as a teaching venue. And the first thing that went through my mind is, well, every church I know is A, cold, and B, has terrible acoustics. These impact not only on your teaching, but also on your health. Again, you see in some places teaching taking place in corridors. If you're putting new classes in, you're changing the layout of the building, how does that affect fire safety? How does that affect workflow, people flow at key times. Access to welfare is another issue. We've seen in some schools, they've said, right, we're turning off all the water fountains. I'm sorry, people have to have access to drinking water through the day. As I've mentioned, the heating, and having the heating is off, the windows are open. Great. And you have also access to toilets. One of the things we're seeing is that they say you can't have more than so many people in the toilet. Well, fine, but you're going to have to work out how to still have people having access to the toilet facilities. I heard in one education venue, the instruction was to the men's toilet was leave the door open. And sorry, no, you can't. This is not acceptable in any situation. You have to come up with a different solution to dealing with this infection risk. We have to look at the work organisation. The employer should be assuming that staff is going to be absent. I mean, people are going to get COVID. That's fact of life at the moment. So when people are coming in, those people coming in to cover, they have to know how the school is dealing with COVID and also what the preventive measures are, what they need to do if there's a case in the students or the staff, if they feel ill and everything like this. I keep talking about work-related stress, violence and harassment, bullying, mobbing, because this is a huge issue within the education sector generally, and it's not going away in these times. Work-related stress is quite simply when the perceived demands on the worker exceed the perceived capacity of that worker to deal with it. Very simply, it's when the worker feels they do not have control. And this happens normally if you've been given class, you're not getting support, you've got threatening behaviour from people. So many causes of work-related stress, especially in the education sector. But if you do not know how you're teaching, if you do not know how to use new techniques or technologies in teaching, if you're terrified you're going to get COVID, if there are many things which will contribute to this work-related stress, and this has to be managed as well. There's also been a change to how work is done in schools, and I put it shift working. And one of the standard preventive measures for COVID is you stagger how classes are run. So year one arrives 15 minutes ahead of year two, and so on and so on. And you reduce the number of people at any one time in the space. And this is essential for protection. But you can end up with some teachers and support staff having long periods of teaching and not so much time between the teaching periods. And this is a real challenge. Maybe not even time to go to the bathroom. And finally, we've got to consider vulnerable staff who may be at particular risk of COVID, but not just about COVID. They may be vulnerable for other reasons, and we have to protect those workers. Okay, so some simple things. I'm not going to go into details on this because there's a lot of guidance around. But one thing is, I mentioned this hierarchy of control, and one of the fundamental things is you remove the worker from the harm, or the risk of harm. And that quite simply means those who can work remotely should work remotely. So, okay, you've got to be on, there's decisions being made, you've got to be in school to teach, that's fine. But what if you don't, what if you're on a non-teaching day? What if your job isn't the direct interface with the students? Can you do your work from home, from another location where you are less exposed? It doesn't have to be permanently off. You could be working partly at home, partly at school. The other thing is you have to consider also the commuting to work and back. If you're getting on the London Underground and you're spending 45 minutes with your nose in somebody else's armpit on the way into work, that's a huge risk of transmission. So if possible, the employer should be looking to facilitate individual commuting. Yes, ideally walk or cycle or something like this, but maybe car parking arrangements should be made so that people can drive in rather than take public transport, so that reduces that transmission risk. While at work, reduce physical contact between workers. So don't have staff meetings, face-to-face staff meetings, don't have parents' evenings, things like this. I did hear of one school that welcomed its New Year's class back into the school and put them all into the hall with all the teachers to have them all welcome. That's not really very sensible. I mentioned again, have shifts to reduce the number of people in common areas. And here's one thing I talked about, the hierarchy: collective measures before personal measures. So if you can, try and have barriers rather than relying purely on masks. You may need barriers and masks. That's fine, that's normal, that's expected. But just because somebody gives you a mask, that's not doing the job. Yeah, where they can put barriers, yeah, you put the barriers in place. You need clear site rules for interaction with third parties. Your delivery driver with the school meals, it depends how it works. They may be turning up there every day. If that guy is not, or that woman is not following the rules, the risk of transmission is much bigger for the people dealing with them. You need to be looking at additional cleaning staff and basically review your whole cleaning regime, because you are going to have to do deep cleaning. You are going to have more cleaning. And also, all workers should know what to do, when and how to isolate. If they think or they know that they've been infected, what are they going to do? Do they know? Who's checking? We spend a lot of time in the agency talking about what are termed vulnerable groups, which is a misnomer. But what we mean is everybody's different. Yeah, you have young workers who have additional risk factors. You have older workers who have additional risk factors. Depending on context, your gender may be important. Workers with disabilities. Many people have issues which they go to work despite or manage at work. And the workplace has to be adapted for everybody. It's no good putting in COVID measures that doesn't help a worker with mobility issues, for example, or a worker who needs frequent toilet access, and you're saying, no, you can't get to the toilet, there's too much space. You've got to adapt for everybody. And you should take into account, you may already have measures for these workers, but how are the COVID measures impacting on those? I mentioned again, stress is a real issue. Stress is there, and there should be support services in place to help with stress. It's a completely another presentation. I can do at length on that, but work-related stress is health and safety, needs to be managed, and has to be taken into account. You have to look at all workers. It's very easy when dealing with the education sector to think teachers, but there are many other workers in schools and education facilities who are there and who have the right to be protected at work. And I come again to stress, when the employers should be communicating with other employers who have workers on the premises or who affect the premises, for example, if they control the property. Yeah, you should be sharing the findings of your risk assessment and working out common measures. This is fundamental to protection. So I will stop there. And before I finish, I will just say that our website at osha.europa.eu is accessible. We have material in 25 languages. It is all free to download. Everything we have is there free to download. We even have teaching plans using cartoon characters so you can integrate health and safety messages into your existing classes. We have a lot of COVID resources, and we have just started a major 3-year campaign on prevention of back pain, musculoskeletal disorders. And this information, again, you can access for free, download. There are videos, there are reports, there are fact sheets, there's animations, the lot. And again, you're free to access them.